Good morning, you guys. Welcome to the Monday training session for CQC managers. Okay, so last week we looked at how to write some policies. I gave you a policy template to look at and how to draft, and we talked about the importance of policy writing. We looked at where it came from. We looked at the importance of the single inspection framework. We also looked at laws, legislations, and we looked at how AI can help you bring together those policies to make them more robust and localized to your procedure. We started to touch on quality assurance and about version numbers, etc., which looks at the ISO procedure, so ISO 9001. I'm going to talk a bit more about that shortly. Towards the end of the week, we then looked at supervision. And I asked you to go onto the Skills for Care website page. I asked you to look at the effective supervision guide. I asked you to look at the templates that were there. And in this week's meeting, we're going to look at their effectiveness and what you've decided on how you're going to conduct your supervision. So whether you conduct it on a one-to-one group exercise, formal or informal, but how you're going to record all of that wonderful enriching evidence there. So we also spoke about the code of conducts. So the code of conducts for all the members of staff. So if we're doing disciplinaries, we're there. And we also talked about performance management and the difference between a supervision and a performance management tool and how the two really should be separate. One is meant to be how you manage your staff and one is for supervising your staff. So it should be a much more uplifting experience. We also touched briefly on time management, and time management doesn't just include attending meetings on time, it also means meeting deadlines. So with that in mind, last week I set a target on producing the template policies and procedures. And ultimately, sometimes in leadership, you're going to be given an instruction, and the instruction may be vague, it may be unclear, or you may feel it to be unattainable. It really is down to your problem solving skills to work out whether or not you have the resources and the time and the skills to perform that task. So, for example, if you are missing something, such as the policies, then some problem solving here really does rely on you guys to then work out, well, okay, Steve's asked us to do this. Why haven't we done it yet? Because ultimately that's about meeting deadlines. So I'm not going to keep chasing you for stuff. By the end of this week, I expect everything to be caught up to date, because if we don't keep up with the program, you're going to fall behind and you're not going to be ready for your CQC inspection, and you're not going to be ready for the CQC interview. I'm only asking you to review one policy and to write one policy, and I'm only asking you to do one supervision because I need to know that you know how to do it. Once I know that you know how to do it, I can then sign you off. So you need to do those, because this week we're now moving forward into the realms of quality assurance, and we're in the realms of care planning. So today I've done a video on how to write the care documents based on the activities of daily living. They've been sent to you in the WhatsApp group, and then I want to introduce you to quality assurance. So you're going to be given this link, to Care Networks. You're going to set up in the network portal. It's going to ask you to register, so just register. Once you're here, you're going to have access to lots of things. You're going to have access to training development, quality assurance, hot topics, stuff around recruitment and retention, and updates. Under quality assurance, you're going to see different things. So you're going to see the quality assurance tools. And if you click on there, you've got your quality assurance planner for the year. So you should have a planner already in place. And the quality assurance planners breaks down around transparency, etc. You've got your policy update document there. So there's lots of tools in there for you to have a look at. So you need to start having a look at those. Again, last week we looked at supervision. We talked about induction, and in there you've got all your different induction manuals, etc. So there's lots of resources for you in there to get your head around. Furthermore, we talked about, or we touched on, why put version numbers on documents, etc. So what's that about? Well, That's really about the ISO standards, 15,000, 14,000, and 45001. So that's quality assurance, quality and compliance. So that's how to write a document, how to produce a document, and the standards in which it should be upheld to. So your internal governance, quality and compliance. We've then got our health and safety standards. So the steps of the health and safety standards there. And then we've got environmental impact, because we're all due to be taking responsibility for environmental impact. So again, understanding those three frameworks, so understanding the 9001, the 45001, and the 14,000, it will give you an idea about benchmarks nationally and their frameworks to work with in health and safety, quality assurance. And there is a framework there for everything. There's a framework for HR, there's a framework for information security, data protection. I think it's 27001. So there's lots of different frameworks there. Then when we look at external audits, so external audits are kite marks. So these are the kite marks that your organization should have. So again, here we've got dignity champions, we've got mental health people standards there, we've got disability employer confident, we've got equality index, we've got investors in people, and we've got the FSB, Federation of Small Business. So again, I want you just to start to have a look at this stuff. I don't want you to do anything this week. I just want you to start looking at it and becoming familiar with some of these tools, because ultimately there is a lot here that is going to underpin your job to help you. Okay, so what are we going to do this week? Quick recap. You're going to meet your targets that you haven't met from last week, which is produce me a policy and produce me a well-rounded supervision. So I want to see that contract, I want to see what you've done, and I want to see how it's developed and pushed people and been used as a tool to enhance practice, not to performance management, but how you're motivated and how you're listening to your staff. The second thing that you're then going to do is you're going to write a new care plan in line with the training. So what you've already got, you're going to upskill that. You're going to really push that forward with lots of I statements there. And then finally, you're going to link into here and you're going to start to get your head around quality assurance. So a massive amount of work for you to start doing. Wonderful. Any problems, you know where I am. I expect you to reach out to me. Remember, it's adult learning. You're doing a management qualification. It's down to you to push yourself and to achieve the goals that you need to achieve. Wonderful. Take care. Bye for now.